like to talk about finger exercises. In anatomy, we could label our fingers in different ways. So we'll label it, this is 1, 2, 3, 4, 5. So the thumb is digit 1, our index is digit 2, our middle finger is digit 3, ring finger digit 4, and last one, pinky for digit 5. So for 2 to 5, commonly our finger could bend down, which is called flexion, and this happens in this joint, this joint, this joint. So we have 3 joints. We actually call it DIP, PIP, and MCP. Okay, so just remember they bend this way down, which we call flexion. It also extends, which we call extension. So the first 2 digits, this and this, we could flex and extend. But this one here, we call the MCP, also could open up this way. So for the thumb, we could go this way. But if we go flat down, it could go always up to the sky and down. Okay? So this going sideways we call extension and flexion, and this we call abduction and adduction. So the most common restriction I see is that people cannot bend or straighten easily. This could be due to pain or injury. So from a regular perspective, most people might have some arthritis which cause some pain and limitation due to the swelling as well. Or you have some kind of sports injury such as basketball or volleyball, which your finger get hit by the ball and then creates injury. So you have limitation of that. So the first thing we want to do is to restore the full flexibility. So for finger, to do flexion, bending down, I would just take your thumb and push it in. I'm showing you in this plane, but you could do it in real life. Just keep your hand down and push it down like that. So if you want to be more specific, you could bend just the tip, okay? And try to bend it down. I will hold for 5-second hold, probably do about 20 times. Or you could do this one here by just focusing on that joint. And the last one would be in here. So I'll show you my pinky. So I'm gonna try to bend down like that. So you target that joint, okay? So in this way I talk about, that's more rare, but if you want, you could actually spread them, okay? Or some people take a ball and push it down like that. And then adduction, usually you don't have much problem. I guess you could hold it that way, okay? So for extension, we do the reverse. I could go specifically to this digit and try to bend it up, which we call extension, that way. Or this knuckle, go that way. Or that knuckle, go that way. So these will help you to restore the flexibility of your fingers. So for the thumb, same idea. You could bend up this way, which is extension, or in that joint, going that way. For flexion, there we go. I'm gonna try to flex it. Maybe this way is better. So we're gonna bend down like that, okay? So these will help you to restore the flexibility of your finger. For strengthening, we could use a rubber band. For the simplest way, if I wanna do a general one, I just loop it around all your fingers. Try to keep it at the very last digit section, okay? You could just open it up like that. Hold for 5-second hold and relax down, okay? If I want to do it more specifically, I could use this. You probably hook it and make a loop or something like that so you will stay, okay? And then I could just focus on the last digit here, okay? Or I move it past the first knuckle and then I could do it this one here, so you'll focus on this joint. Or you can move it in and then you could do the last one here. Okay, but typically if you do it at the furthest point, you'll get 3 of them. So that's for extension. So I would do 5-second hold against the band and do about 20 of them. Then we do the flexion, the totally opposite. So we're gonna loop it again. And you could, this way, you could flex down on that digit, 5-second hold, 20 of them. And you can move down to this knuckle, be more specific there, and go to this joint and go that way, okay? So that will cover these 3 joints in extension and flexion. So same thing for these, we call abduction and adduction. Abduction, I simply just cross them like that, and you could open up, okay? Or you could just do it on 2 fingers specifically. So hard, I can't do it. So make it less. And then that's for opening. And then if I want to do closing, which is the adduction, I'm gonna just bring it in this way, okay? I'm showing you towards the camera, but you can put it on the bed or a table and then just do it like that so your hand doesn't have to be held up in here. Okay, so that's for flexion and extension, abduction and adduction, strengthening. So for the thumb, we do the same way, okay? The thumb, like I said, could go this way when it's more palm down situation, could go in that way, okay? And if I flip it this way, I could go like that, strengthening again. And then for the abduction, because the direction, just remember if your palm is facing the sky, you could go up towards the sky, okay? And then down will be going down to the floor, okay? So the angle is like that. So the other option for the flexion, I just use a ball. So this is just a little tiny squishy ball. It's a bit softer, so I would say we could begin with this. When you get better, you could use a tennis ball. So I'm gonna just basically hold my ball here. I want you to see, perhaps you could do, I'm gonna just do it more specifically. So if I'm gonna rest these fingers on the ball, but just to show you, I'm gonna do my thumb, my 1 and 2. I'm gonna squeeze down, 5-second hold, and relax down. So in real life, I don't necessarily keep these up, I just rest there. But I want you to squeeze 1 and 2 more. 5-second hold, 20 reps. Then we move to the middle finger, which again, I'll show you. You could squeeze 1 and 3, but again, rest your hand, okay? So far, you could do more with the 1 and 4 and 1 and 5. Or when you get better, then you could do 5 of them together. Okay, so you could do this if you're watching TV or doing some work or something like that to build up the muscle. So that's an easy way to do. So for the rubber band, if we do 5 of them together, you could try to just open them up like that, okay? The benefit is you might be able to do all of them at the same time, but the disadvantage is that you might only work on the one that's stronger. The weak one never gets trained. So it's better to do it individually like I showed you before. There are other tools such as this, we call Powerweb. It basically is a elastic net. So the color actually represents different grade, but we could use this if I try to spread my hand as far as I can, and I could squeeze them in. So it's the flexion that we talk about. I could do it specifically just with 2 fingers and work on them, okay? And then we could also go in together, very close, and open up. So it just makes it easier, but I would say every day just use the tennis ball and the rubber band. It's quite useful. When you do these finger exercises, the range of motion, make sure you could bend it further to the point you feel a little bit of discomfort, but don't hurt it too much, okay? For the strengthening, same thing, you wanna just work it to medium level. If you can last 20 reps, please just stop before you get there. You don't wanna tire out your hands too much. And in general, the hand rehab time might be longer, okay? It could take up to 4 to 6 months that I've seen. And so don't get too anxious, but just be persistent and be careful not to hurt it and overuse it, and it will recover.